republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. So we'll do our first call to the public. Is there anybody here who would like to address Public Safety and Courts Committee? Seeing none, we're going to add an agenda item, and that is a presentation from the Child Care Program, the TriShare. And we have Courtney Herrick here.
Yes, hello everybody. We just wanted to take a few minutes and give you some information on the TriShare program, the RESD in partnership with the Shiawassee Economic Development Partnership are the hub for Shiawassee County. This is a state program. TriShare is now a line item in the workforce development budget. So this program is designed to increase the affordability of childcare for families. So you have some information there. There is an income eligibility range, so it supports those families that are not eligible for the DHHS child care subsidy and goes all the way up to 325% of the federal poverty level. So that kind of breaks out depending on household size and household income. So the how TriShare works is we're in the process of recruiting employers. So that's why we're here in terms of hoping that the county would utilize this program as a recruitment and retention tool and a benefit for employees. It splits the cost of childcare 3 ways. So for Shiawassee County, it's a 2-2-2 model. For every hour of childcare, the employer contributes $2, the family contributes $2, and then the state contributes $2. So we actually have $300,000 that was allocated to Shiawassee County for the TriShare program. So we really want to be able to help families that are paying for childcare. We also have some grant funding from the Cook Family Foundation. So for those entities that are nonprofits that would not get the tax benefit for participating in the program, while the funding lasts, we have reduced that $2 contribution to $1.50 per child care hour.
From the employer?
For the employer's side, yes. And again, that's kind of temporary until the Cook Family Foundation provided $50,000, where we've been able to provide some incentives to recruit employers. So right now we have 4 employers. We have the Shiawassee YMCA, the RESD, Spartan Fence, and Midwest Bus. So those are the current employers that are participating in the program. So Cindy, we have a survey that we sent out to county employees. So I did provide some data just to give you, obviously you want to know how much is this going to cost. And you can actually set a budget. Some employers have done that and said that they'll allocate $20,000 for the year to spend on the TriShare program. So it's very open to be tailored for how it works for you. But based on the survey responses, we had 8 surveys that were returned. 4 employees were eligible for TriShare, 2 employees were over the income eligibility, and 2 were under the income eligibility. For those 2 that are under, we connected them with the DHHS subsidy. So the good news is 6 out of the 8 would be eligible for some child care support. So in the top portion of that table there, it shows how we break it down in terms of children in full-time care, part-time care, and then before and after school care. So these are just general, so full-time care is considered 45 hours. So what we did is break down that cost at $1.50 for the 45 hours for the 2 children for 52 weeks to get that estimate, the annual estimate of $10,530. But below, because families filled out the child care survey, we had more information. So for example, one child, the parent only works 4 days a week. So the full-time care for that child was actually 36 hours. So we were able to calculate a more accurate representation of the families that would be eligible for the county. So you can kind of use that. And again, we broke it down at that $1.50 rate and the $2 an hour rate. So I don't know if there's questions, comments.
What I had is in mind was that we'd have more commissioners here, but actually I would like everyone to kind of take a look at this, think about it. If you have any questions, reach out to myself, reach out to Courtney. And I'm going to put this on to Health and Human Services for next month, and I'd like to approve it and try it for 2023. If we can do this for it looks like under $10,000. We could use it as a retention tool, a recruiting tool, and just see how it goes. I mean, it's a very minimal cost in childcare from what I hear. I'm past those times of my life, but
And it
can
is
be
for
quite a
those children
challenge.
that are in licensed childcare centers. So it has to be a license. It can be home-based, but as long as there's a license. So it can't necessarily just be family and friend care. So,
But if you think about the burden that lifts off of a family of $4 an hour for childcare,
yes.
that is
Yes.
substantial.
Absolutely. It's
Without
it's
a
really
huge
an
cost to
investment.
us because the state contribution and cost of the cook family.
Yes, absolutely. And we're excited. It's no longer a pilot. Initially, when we got involved this spring, it was a pilot program, but the state has taken pilot off, and it's a line item now with the anticipation of annual funding every year. So, and the state is even, we have a meeting next week, they're looking at possibly increasing the eligibility criteria, so bumping it out a little bit further past the 325% of federal poverty level.
What would it look like on our end as far as administering this program? Like what?
So that's a really good question. The RESD has taken on the role of kind of being the hub coordinator. So we're working with the child care providers. They send us, the parents continue to pay the provider like they usually do. It's just at a much lower rate. Then the child care provider sends us the invoice of the number of hours that the kiddos were in care. And then we're typically billing the employer once a month. So we will go ahead and calculate all of your costs because we're doing that reporting for the state as well. So we will track all of that. You'll be invoiced, so it'll just be a matter of paying a bill monthly. And if you would like it more often, I feel like one of the businesses we do every 2 weeks.
So we pay RESD and the RESD pays providers.
Correct. Mm-hmm. Yes.
Right.
Thank you for your
Thank
time.
you so much for being here.
Yes.
All right, let's move on to our agenda items for public safety and courts. Agenda item A, I would entertain a motion to approve the purchase of an AIS CAM server from Motorola Solutions in an amount not to exceed $83,153.
I will make that motion.
I'll support that motion. We have Lieutenant Norling here. Do you want to share a little bit with us about this?
Absolutely. So this is equipment that most 911 centers are already equipped with. This is kind of getting us caught up with the times we have. Right now, on all the portable radios, there's a red button on top, which is the emergency alert button. And when an officer hits that, when they're in trouble, we get an alert and dispatch over our radio system. However, right now, excuse me, we have to, so when they log in every day for their shift, they put in their radio ID number into our computer system. So when that emergency alert is hit, we're fumbling through trying to find which officer hit their radio. This equipment allows us to go in, because each individual radio has its own individual ID, so we can give it an alias, so to say. So Sheriff McCall, because he carries the same radio every day, we could title it 221 or McCall. So if his button goes off, it immediately tells us which officer has hit that button. So it's an officer safety type of thing. It gives us the ability to check on them quicker, to make sure they're okay, that they have good status, and we know exactly who's hitting that button. So did I explain it okay? Okay.
I'm assuming it's also an upgrade in capability in some other way too. It's not just the alias identification of the radio. It must be bandwidth or something else.
Yeah, so it connects all through with the state system, and so we have the ability, so like if there's new officers, we can go in and change it and update it, and so on and so forth.
Okay.
It's a good tool, it'll make things nice, easier for us when we're trying to hurry up and check somebody's status to make sure they're okay, so.
Okay, thank
Okay.
you. Any other questions or discussion? All in favor of moving this on to Wednesday night, say yes.
Aye.
Aye. Sorry.
It's fine.
I do yes and no on Zoom meetings, 'cause
Yeah.
it's much less confusing when people chime in with I later, so. Okay, moving on to item B. I entertain a motion to approve the purchase of 5 computers from Dell Technologies in an amount not to exceed $6,965.05.
Support.
Motion
Motion.
I'll make the motion, okay.
Well, okay, motion and support. Any questions or
Either way.
discussion? On this one?
I saw it lasted quite a while, running all day long.
Yeah, 24/7, and we've
Yeah.
got multiple programs running all the time, we're just getting kind of bogged down.
Yeah. They just,
Yeah.
that's the life expectancy,
Yeah.
if there are good ones.
Yeah,
Yeah,
yep.
yes.
All right, all in favor of moving this on to tomorrow night, say aye.
Aye.
Any opposed, same. Item B carries on. Item C, I entertain a motion to approve the refilling of an animal control officer.
I'll make that motion.
Support.
I have a motion and support. Any questions or discussion? Hearing none, all in favor of moving this on to Wednesday night, say aye.
Aye.
All opposed, same. Item C moves on. Last call of the public. Anybody want to address this committee? Before we adjourn this meeting, do we have an answer about what to do about the Health and Human Services? I don't want to adjourn if we can make some kind of motion. What's the answer, Morgan?
He said that since there's not a quorum, obviously there's no voting, and that the committee as a whole can acknowledge it tomorrow and just decide to take it up.
Okay,
Very good.
that's what we'll do then. All right, with that, hearing no objection, this meeting is adjourned.
Okay.